7, 6, 5, 4, 3, 2, 1.
Okay, so in this video, I wanted to talk about kennel cough. I think that it's something that a lot of people have to deal with in their animals. I've definitely had to deal with my dog getting kennel cough, and it's something that a lot of people don't have information about, and so I'm hoping that I can revise some of the stuff that I've studied and present it to you guys. So I study infectious diseases, so I've got a good background on the physiology and what happens when a body goes through an infection and all that kind of stuff. Anyways, boring stuff for most people. But I wanted to present some of this information for you guys. It might be something that you don't know about really, and it's good to understand what kennel cough is, why it causes that cough, and kind of what to do in the end with it. And so I guess the first step to understanding kennel cough would be that kennel cough is not just one thing. Kennel cough is in fact something that can be viral and it can be bacterial. Those are two very different things. So we'll focus on viral first, and then we'll go to bacterial. So a virus is something that you can't treat very well. It's something that you could prevent with a vaccination, but it's not something that you can really treat very well. It usually has to run its course. So with kennel cough, there is a vaccination out there, but I should point out that it is like our annual flu shot. It does not cover everything. And so it's very likely that you could get your kennel cough shot for your dog and then have your dog come down with kennel cough as well. Just have a different strain that's not included in that vaccine. Just like your annual flu shot doesn't ensure that you're never going to get sick over the holiday season, right? So viruses have to run their course. Usually the main types of viruses involved with kennel cough are adenoviruses and parainfluenza virus. And that might not mean anything to you guys, but it's just extra information, I guess. But yeah, so a virus, you have to let it run its course. It's going to cause coughing in your dog, but usually your animal will have a couple of days where it gets worse, and then it will show a significant improvement later on during the diseases, as the disease runs its course. Now with a bacteria, it's very different because bacteria we can treat. And so if your dog has a bacterial strain, the main bacteria that causes kennel cough is Bordetella bronchoseptica, and that we definitely do have antibiotics that can help out with getting rid of that bacteria. The main antibiotic that I believe is used, at least what I've seen used in the past 6 years that I did work in vet clinics and from my education as well, is clavaceptin. It has amoxicillin in it, which helps kill off this bacteria. This bacteria is a gram-negative bacteria for all of my science geeks out there. And yeah, so it is a bacterial strain that can cause a lot of issues if it's not treated. So it's definitely very important to get kennel cough treated if it's the bacterial form. Now, the viral form will run its course. The bacterial form, you will see a continuation of your dog getting worse and worse and worse. The coughing will get worse, the restlessness will get worse. And so probably if your dog doesn't start to get better over 4 or 5 days, then it's something that you might want to start considering taking them to the vet for. But it's very important to remember that there's two different ways that an animal can get kennel cough, through a virus or through a bacteria. Now, the way that you get kennel cough is very similar for both of them. A lot of times it's close contact with another dog. So if your dog is, playing in dog parks, definitely it's a way that your dog can get kennel cough. Another way is through aerosol droplets in the air. So when your dog sneezes or coughs and it's infected, then those little droplets can land on the ground, and then another dog can come and sniff that up, or even if it's coughed into the air and then another dog comes in contact with that, that's how they would get kennel cough. Another very important way that they could get kennel cough is if there's vomit on the ground. And a lot of people don't necessarily think about vomit, but vomit can contain sputum, and that has all of the mucus and stuff that contains infectious agents in it. And the more watery the environment is, the better it's going to preserve those infectious agents. So the thing with a bacteria or a virus going into the environment is that it can be dried out very quickly if it doesn't have certain ways of protecting itself. And so if it's in a nice moist environment, of course it's going to be nice and happy. It's not going to dry out very quickly. So if you see vomit on the ground, it's important to not let your dog get anywhere near it, to not even let it sniff it, because that's most definitely a way that you can get kennel cough, or that your dog can get kennel cough. I think that I've covered almost everything. Let me see here. So I guess the one thing that I can tell you about is kind of what causes the cough. So the cough is caused by inflammation. Of course, when a infectious agent comes into your animal's respiratory tract, it's going to cause a lot of inflammation in there. Especially the bacteria, it produces a toxin that causes a lot of inflammation. So your dog coughs a lot because, number one, the cilia in the respiratory tract isn't helping push all of the gunk out of there anymore, or not as well. So there's these little tiny fingers on the cells in there that help push all of the fluid out. And if that's not working very well, your dog has to cough more from deep within the lungs to try and expel all of this stuff. And then also, there's a lot of inflammation. So a lot of the cells are inflamed, it's just really aggravated, and your dog it doesn't feel good, and so it has to cough. So that's what's causing the coughing. Like I said, in order to get rid of that, if it's a viral strain, you let it run its course. You can't really do anything about it. It just has to run its course. If it's a bacterial form, most definitely you can put your dog on antibiotics. Now, the main thing you have to decide upon is whether or not you would like to put your dog on antibiotics, even if it only has the viral strain. No vet is really gonna test to see whether or not your dog has a viral form versus a bacterial form. The main way to see is just to let it kind of sit for a little while, and then if it gets worse and worse, then you go into a veterinarian and you get your antibiotics. But it is probably not a good idea to use antibiotics if you don't need to, just because antibiotic resistance happens a lot because of the misuse of antibiotics. And if you don't need them, then it doesn't really make sense to actually have them. So if your dog gets better over a period of 4 or 5 days, definitely probably a viral strain. It's probably going to run its course. If your dog keeps on getting worse and worse, it's probably a bacterial form, and it will need antibiotics to resolve itself. So I hope that this gave you some information. I hope that I didn't make it really complicated. I think it's easy to tell, virus, bacteria, they're very different, and the way that you treat them is very different. I just hope I didn't jump into too much detail, because I have a problem with doing that. But if you have any questions, you can always leave them in the comments down below.